So we are excited to jump right in. We'll give everyone another minute to join us, but we're really excited for our virtual hangout. It's a combination of an integrative discussion that we are very familiar with more learning about acupressure. So we've got a true expert in this space. So we are excited to dive right in shortly. And I am super excited to be joined by my dietitian colleague, Aubrey, for our virtual hangout today. So it's really nice to be with all of you tonight.
Yes, and so happy to be here. Very excited. We were talking about before everybody hopped on that this is just such an interesting and relevant topic. And as many of you know, our virtual education events couldn't happen without our sponsors. So our events are presented through UFH Connect by West, Merck, Lilly, Novartis, and Gilead Sciences, with additional support from our gold sponsors, Pfizer, GSK, and Daiichi Sankyo, and our supporting sponsors, AbbVie, Agendia, and Tercera Therapeutics. So we are so thankful to our sponsors so that we can bring you guys education series like this. If you haven't hopped on a virtual hangout or her speaker series previously, welcome to our May speaker series. If I can introduce myself, I know Erin mentioned my name is Aubrey Red. I'm one of the senior culinary dietitians here on our team. So just a little housekeeping before we get started. If you are not a typical Zoom user, maybe you're not using it all the time, if you can just keep yourself muted throughout the presentation, helps with any background noise. We're going to start with some presentations with time for questions at the end of each topic. And then again, at the very end, you can raise your hand or you can put your questions into the chat. And just so everybody knows, we'll be recording this presentation so it can be viewed in our Her library once it's done, about 24 hours from now.
Yep, perfect. And, this is not the last of our education segment. So very quickly, I just want to tease a little bit for what we have for the rest of the month of May. So tomorrow, join me live. We have an Ask the Experts tomorrow. That's Thursday, 1 p.m. Eastern time. We have a Q&A segment all about radiation. So I'll be joined by Dr. Eva Berlin. She'll be answering all of your questions, what to know about radiation, what to expect, short-term, long-term side effects. So really looking forward to that, streaming live on the Unite for Her Facebook page. So that is tomorrow, Thursday, the 22nd, 1 p.m. Eastern time. And then we are rounding out the month of May next week with our second virtual hangout of the month. And together we will be building your mental health toolbox. So we will be joined by one of our very own mental health providers, ecotherapy specialist and licensed professional counselor, Kevin Hubbard. He has been with us for various segments in the past. We just love him. And he'll be diving into how we can all build our own toolbox to support our mental health. So that is next week, the 28th, 5 p.m. Eastern time, our second virtual hangout of the evening. So we'll put all of that. Thank you, Aubrey, for popping all of that into the chat. Of course, you can see all of our segments, including tonight's, in our UFH Connect video library. But with that, we've got a lot of material to cover. So I want to introduce our speaker for tonight. So it is truly my pleasure to introduce Dr. Michelle Loy. She is a nationally recognized quadruple board certified physician who received her BA from Harvard College, her MD from Weill Cornell Medical College, pediatrics residency at New York Presbyterian Cornell, and integrative medicine fellowship from Columbia University, Stanford Hospital. She utilizes evidence-based interventions from modern medicine and traditional modalities, including nutrition, movement, acupuncture, botanicals, and mind-body medicine to prevent and manage chronic medical conditions across all age groups. All of this is happening at the Integrative Health and Wellbeing Weill Cornell Medicine Center. She holds board certifications in integrative medicine, lifestyle medicine, medical acupuncture, and pediatrics. And in her recreational time, she enjoys reading, swimming, running, exploring farmers markets. Me too. I think we all love that. And creating healthful, whole food, plant-forward meals for her family. So it is truly my pleasure to welcome our expert this evening, Dr. Michelle Loy. Dr. Loy, thank you so much for being with us tonight.
Thank you so much, Erin. Let me share my... Okay, so today we're talking about acupuncture and acupressure and how these healing points can help us throughout the continuum of cancer care. So I'm going to give you some hands-on guidance on key acupressure points. These are some of the points that I share with my patients in our oncology group visit, Living Well With and After Cancer. And these are common points that can help with symptoms that we sometimes face or struggle, like discomfort, nausea, fatigue, insomnia, hot flashes, and stress. And just overall, these are evidence-based techniques that help with our overall comfort and well-being. So just to start off with, what is integrative medicine? What is integrative oncology? What it is that we use the best of both worlds, the best of cutting-edge conventional care, along with evidence-based complementary integrative therapies. And these therapies can include mind-body practices, nutrition, natural products, and other lifestyle modifications. The NCCIH arm of the NIH, I really like this graphic because it shows that not only might we use medication or surgery, or as you're going to learn about next week, radiation, but we also use things like, natural products like medicinal plants, nutrition. Under that, there's probiotics, prebiotics, phytochemicals, right? I speak a lot about, I know this is not today's topic, but I talk a lot about the benefits of a plant-forward whole food diet, herbs and spices, vitamins and minerals, right? And then the psychological mind-body practices like mindfulness-based stress reduction. And actually, right after this, I'm giving another talk or moderating a talk on the role of spirituality and in whole person health and religion and meaning and purpose. So art and music and dance and yoga and qigong. So, and then there's manual therapies and acupuncture. So this is all part of the toolbox. The next few slides actually talk about, so I don't know if you're familiar, but the American Society for Clinical Oncology, one of the main, oncology groups in the US, they actually adopted a number of integrative medicine guidelines produced by the Society for Integrative Oncology. So this slide here talks about pain. And what happened was the SIO, and then adopted by the ASCO, they looked at all the different symptoms related to pain, the evidence on the different therapies, the type of recommendation, how strong was that evidence, and how strong is the recommendation based on the risk benefits. And so if you look here, whether it's aromatase inhibitor related joint pain, I think every day I have multiple patients with these symptoms that are referred to us by oncologists, whether it's general cancer pain, whether it's chemo-induced peripheral neuropathy, procedural pain, surgical pain, or pain during palliative care. You can see that acupuncture, which is our topic today, or acupressure, comes up in many of these boxes, pretty much. Definitely for AI-related general cancer pain, chemo-induced peripheral neuropathy, and surgical pain. And so you can see that there is evidence behind it, pretty good evidence. Then when you talk about anxiety or depression, same thing during post-treatment for anxiety. You see acupuncture here for depression, both during active and post-treatment. No, actually, mostly during active treatment, actually here. I thought I saw it in here. Maybe not. This was, okay, maybe I was, sometimes I'm giving talks on yoga too. Okay, so mainly here for post-treatment anxiety. Then for fatigue, we saw this where I saw it. We see for after active treatment, you have acupressure can be very beneficial. So this is based on what the evidence that's out there. And then this is from the NCC and the National Comprehensive Cancer Network Clinical Practice Guidelines. And if you look here, acupuncture is here for these particular symptoms. I also give a lot of talks about yoga, so I always say yoga ticks off almost every one of these boxes as well. But you can see nutrition, exercise, music therapy, massage, meditation, they all have their place as well. So in my integrative oncology consultations, I will go through the main lifestyle pillars: nutrition, physical activity, sleep, stress management. I'll go through all the medications, the herbs and supplements, make sure there are no interactions, and then spend the bulk of the time talking about the various symptoms and what we would like to control. And so again, you can see acupuncture is helpful for pain, for fatigue. We saw it under the guidelines for anxiety, definitely for nausea and vomiting, definitely for neuropathy, for dry mouth, and for hot flashes. So I love this proverb, African proverb: if you want to go fast, go alone. If you want to go far, go together. And there really is a lot of data on the role of social connection, social support, and survival. This is an old study done, I think it was out at Stanford, published in Lancet in the 80s, showing that support groups doubled their survival rate in metastatic breast cancer. And then a much more recent study called the Life After Breast Cancer, the LACE study, showed that social network, social support really also was very, very protective as far as survivorship. So, we'd like to say that, getting by with a little help from our friends is very, very important. And this is, what Unite for Her does a wonderful job of doing. And I want to mention that, social connection is really a protective factor. They have seen that social isolation is a risk factor, much like smoking or some other, other risk factors. And we think probably the reason why it's so protective to have this social connection is the way that it affects the endocrine, the neuroendocrine, and the immune system. I will say, we know this from the Blue Zones data, that the social connections, it can be through family, but also, friends, or, in the Blue Zones, they have these, in Japan, they call them moyas, which are these groups that these social groups that people have from, I think, the age of 5, and they basically, throughout the vicissitudes and different stages of life, they stay together and become like they're friends. So wherever we can have the social connection, whether it's through family or friends, or through groups like Unite for Her, or through group classes, or shared medical appointment, there's benefit there. So I started this oncology group visit series a couple of years ago now. We've actually published on it, but we also have other group visits at our center, all covered by insurance, including integrative medicine, brain health, bone health, metabolic health, yoga, qigong, mindfulness-based stress reduction. And these are the group visits that we offer to all our patients, including our oncology patients. So the Living Well with and After Cancer group visit is a 7-week series. And today I'm going to share with you some of what I share with patients on during the week that I cover acupuncture and acupressure. So acupuncture is a complementary therapy system, and it was developed as part of traditional Chinese medicine, but it's only one of the tools in their toolbox. So we also use herbal medicine, traditional dietary therapy, which is very closely related to nutrition. I gave a whole 2-hour workshop on that at the American Academy of Medical Acupuncture conference this past year, but there's a lot that can be done with nutrition. Manual body work, so Tui Na, which is kind of like Chinese massage, Qigong, and Tai Chi. These are all, which we offer at our center. These are all tools within the TCM toolbox. And there is a strong belief in this medical system that physical and emotional aspects of health are not only related, but inseparable. And there's a very strong emphasis on prevention. And the idea is to create a balance between what is called yin and yang in order to keep what we call qi, or the vital energy force, moving freely throughout the body. So the idea is that there are these highways throughout the body. We call them meridians, and they're associated with various organ systems. And the idea is to unblock the traffic jams, basically. And when there is either excess or deficiency or stagnation of qi in the body, that's when we have disease. Acupuncture was, the interest in acupuncture was peaked in the 1970s when one of the New York Times correspondents wrote about his experience with acupuncture after an appendectomy. And as I mentioned, so acupuncture, so this picture here shows you some of the meridians based on the different organ systems. So people often think, oh, well, if I have gastrointestinal issues, are you going to be sticking needles in my belly? And actually the meridians run throughout for the stomach and spleen meridian, they run throughout. For example, the stomach, what I'm going to show you one point, goes along the front side of the body. The point I'm going to show you is along the leg. But so there are many access points that you can use to address different conditions, different organ systems. And even the ear is a microcosm. And so some people just get acupuncture on the ear. That's also an option, or acupressure. And each point will, basically release the vital energy. And acupuncture needles are very small. They're thin. They're disposable, sterile needles. People ask how big they are. You can fit probably 10 or 12, depending on the type of acupuncture needle, into the bore of a blood draw, a typical blood draw needle. So they're very, very small. And, they can be done in young children. And we do it in some of my oldest patients are in their late 90s, mid to late 90s. Very, very gentle, doesn't interfere with any medication. And what I love about it is that it can address more than one, even multiple issues in a particular setting. So how does this work? How does acupuncture work? Well, there are a couple proposed theories. Probably it's related to the conduction of electromagnetic signals. I mentioned the role, the effect on the hypothalamic pituitary adrenal axis. So that's why it often helps with stress-related conditions. It probably helps with the secretion of neurotransmitters, potentially our endocannabinoid and our endogenous opiate systems. And later I'll show you a slide where when they put a opiate blocker, it did turn off the effect. So we know that there should be some endogenous opioid probably where there's some kind of effect there. Now, in more recent years, we look at functional MRIs, PET scans, and EEG, and we have seen that with acupuncture, you have more blood flow, you have more tissue healing. Of course, you have the release of analgesics, so those are, pain-reducing chemicals. There's a reduction both in the intensity and perception of chronic pain. For neuropathy, for example, which is a difficult condition to treat. I mean, we have some medications that we can sometimes use, but sometimes they don't work completely. But we have seen acupuncture can sometimes help with certain patients with neuropathy. Muscle spasms, the relaxation muscle spasm, and reducing stress. If you look at the WHO list, acupuncture, there is evidence for 117 conditions, but I would say in my clinical experience, and I find that it's especially good for any type of musculoskeletal pain, any kind of tension, very good for any type of nausea or vomiting, good for sleep, anxiety, so a lot of the mental, emotional kind of symptoms, very good, and very, very good for GI conditions across the board. Also very good for hormonal conditions. So the FDA classified acupuncture needles as a medical device to ensure safety and efficacy. They have to be made of stainless steel, sterile, single use. There are a number of this was in 2024, an international paper on safe practice for acupuncture. So really there's quite a bit of data behind this. I know this is very small, but it just basically highlights so many different clinical practice guidelines, so many different types of cancer and populations, so many different types of symptoms. And, you know, here on the right, they talk about any contraindications, which I'll go through, but they're really very few. I mean, the main ones are if the patient doesn't want it, there's no appropriate consent, you know, the patient is profoundly immunocompromised or in isolation, like post-bone marrow transplant. But they're very, and there are a few others, but there are very few contraindications. This was the study I was telling you about. It's a very old study, but basically showed that when they gave naloxone, which blocks the opiate receptors, then it also reversed the acupuncture effects. So, you know, compared to a lot of pharmaceuticals, it's just no comparison, really. There's no, you know, interactions with medication, toxicity, very few adverse effects. Sometimes you have a little bit of bleeding, for example, on the ear where it's very, there's a lot of vasculature. It's safe in all ages. There is a study at Columbia from Elena Lattis's group, which was looked at even in pediatric patients, I think it's here, yeah, who had solid brain tumors, leukemia, stem cell transplants, and they had low platelet count. There was no issues. It was safe for them as well. I will say though, like if a patient has platelet count less than 20,000, we usually will avoid acupuncture just for best practices. But you know, that's why and I'm going to end with where you need to make sure you find an acupuncture practice, you know, ideally in like a place like in our hospital. You know, we have vetted all the practitioners, and they're they're trained in dealing with oncology patients, properly credentialed. They have experience in treating cancer patients, and Unite for Her can also direct you to the you know, places in your area where you can access safe acupuncture. But I also will give you some resources at the end. Okay, so again, what can we use acupuncture for? I'd say in my experience, pain, fatigue, immune support, night sweats, hot flashes, joint pains, GI symptoms, neuropathy. These are sort of the high-level ones that we use all the time. Another study, this was done with my colleagues at Sloan Kettering, looking, basically the point was whether it was electroacupuncture or auricular acupuncture effective, or regular body acupuncture, all very effective for chronic musculoskeletal pain among cancer survivors. Patients will often ask me, well, how quickly will you see the effect? It can be immediate, it can be weeks. Usually I recommend giving a trial of maybe 6 to 8 weekly treatments. This is what also, we have several studies showing this. 8 weekly treatments showed meaningful reduction in hot flashes in these 2 studies. I'm going to keep going, but chemo-induced peripheral neuropathy. These are 3 randomized controlled trials. You know, in some of the trials showed some effect, some didn't show very significant improvements. But in my experience, I think it is worth a try because current standard of care doesn't always work. And it, you know, we've had between acupuncture and yoga and qigong, really good effects for our patients. As I mentioned, a number of them are able to either reduce or go off some of their, like, you know, gabapentin, for example, some of their medications. So it's definitely worth a try. And Ting Bao, who was at Sloan, now she's at Dana-Farber, she had done a phase 2 trial looking at acupuncture and chemo-induced peripheral neuropathy. I think now that it's in a phase 3 trial, if I'm not mistaken, and perhaps a multi-center study as well. But they basically did 10 sessions over 8 weeks. These points here are large intestine 11, so here on the arm, LI4, which I'm going to show you later on, which is in between the thumb and the pointer finger, Sangel 5, stomach 40, which is close to the other point I'm going to show you later on. And then there are some points that are in the webbing of the hands and feet. And they show reduction in pain, numbness, and tingling in the acupuncture group. Here you can see usual care on the top, sham acupuncture, which is acupuncture, but not on the acupuncture points. And then real acupuncture, you could see definite reduction in pain, and even a persistence 4 weeks after the treatment ended. You have a wide variety in patient demographics, in cancer types, in stages, in the type of chemotherapeutic treatment that they had, and you see the ethnicity breakdown. This slide is just to show you some of the points on the ear. This is a particular protocol, but there's the NADA auricular protocol, which was initially developed actually in one of the hospitals in New York a long time ago, I'd say probably 20 or 30 years ago. It was for substance abuse, but it can be used. Other studies have shown that it has been helpful for improving quality of life in patients with cancer and blood disorders. For sure, acupuncture, auricular acupuncture is used widely in the VA hospitals for a number of pain conditions, not specific to cancer, but across the board. And it's also used in ERs across the country, peds ER, adult ER, for various pain conditions. This was a study looking at acupuncture helping chemo-induced low white blood cell count, which is very helpful because sometimes treatment has to be held because the white counts are too low. But I was really happy to see this systematic review meta-analysis showing that the benefits of acupuncture on strengthening the white blood count. Acupressure, this was a study on acupressure in hospitalized patients with cancer. And after the acupressure, there were improvements in stress, fatigue, pain, heart rate, and respirations, better sleep, better mental clarity. And these are some, later on, if I have time, I'm going to show you some of the points we use for emotional freedom tapping. And if you just kind of take a look at this picture, you don't remember exact points, you're going to see that these are very, very common points that we do acupuncture or acupressure or tapping on. So lots of ways to access these meridians is the point. And honestly, if someone doesn't want needles, doesn't want to do acupuncture, then you can do acupressure. And I'm going to show you an app that you can use that will show you the points, and then you can just massage yourself. So these are a few points I'm going to show you today. So how do you do acupressure? You basically just apply gentle, firm pressure to the point. So this picture here is LI4, large intestine 4. Doesn't matter what the name of it is. And you just press and hold, make little circular motions on that point. You can do it up to 3 minutes. I mean, that's kind of a long time. I usually just do it for a few seconds until I feel it. The points are on both sides of the body. So I just did the left and now I'm doing my right. And you can do it as frequently as you like, multiple times a day. And you just use firm pressure. I mean, obviously don't do it if you have an open cut or bruise, but just firm pressure. You know, I will do this. I tell my patients, like when I'm in the dental office, I will do this exact point actually. And then sometimes I'll even do it on the mirror on my foot. So between your first toe and your second toe. And obviously in a dental chair, you can't be massaging your foot. So then I'll use the back of my ankle and kind of just press on that. So those are called the 4 gates, really good for pain, for anxiety. You should not do this LI4 point if you're pregnant about to give birth, because it's a strong point. Our acupuncturists will use it to bring on labor if people are post dates. But it's really great. This is great for pain, migraines, anxiety, fatigue. Then as far as nausea and vomiting, this is a very famous point called pericardium 6 or 内关. If you've ever used a C-band, like if you're have motion sickness or on a boat, you know, those C-bands you can buy, they're just like a wristband and there's like a little button. So this is the point that you should put it on, pericardium 6. So if you look at the picture there, kind of where your wrist, right here, the crease, then you could do about 3 finger lengths down in between the 2 large tendons right there. That's pericardium 6. And that's a very good point in that groove, that point there. Very good for nausea. Again, it could be any type of nausea. It could be motion sickness. It could be pregnancy-related nausea, chemo-induced nausea. And I mean, I know today we're talking about acupressure, but I can't resist talking about ginger. Ginger is very, very good for nausea. I use it in my practice all the time for patients. You can either just put it in, like make a tea out of it, or buy a tea bag, or just boil it in water. Or just, you can also use ginger supplements, or even just like a ginger chew or ginger candy. But ginger is very, very good for nausea as well. For pain and headaches, this is the Li4 that I showed you earlier, a hogu, in that sort of soft, fleshy web. If you kind of loosely make a fist, you can kind of see like a little mound, and that's the place to do it. The highest point. And then yin tang is one of my favorites. I like the shenmen, one of the ear points, and then this yin tang. I like to do those points first for patients and then relax them, and then we can put the other points in. So they call it, if you do yoga, you know that it's like one of the chakra points, but they call it yin tang, or hall of impressions, right between the eyebrows. And you can just gently press right there. It's very, very good for stress, for anxiety, for insomnia. Great point for that. Headaches, migraines, very good. And then do 20, or Bai Hui, the governing vessel, or they call it 100 convergences. So you kind of make an X from ear to ear, and then from front to back, and right there in the middle, right there, that's do 20. And that's actually one of the tapping points that is used. There's actually 4 other points like directly around that do 20, which I also will use sometimes for ADHD, focus, brain fog as well. And then this is the Zusanli. This is they call it leg 3 miles. So it's like really good for fatigue, right? Really good for energy. It's also good for constipation. It's on the stomach meridian. And so you find your knee, like the bump under your knee, and then you take 3 or 4 finger breaths down, and then slightly move toward the side. So toward toward your shin bone, and you should be able to feel it if you're in the right spot. You almost feel like a little dullness or soreness, then you know you're in the right spot. And then, so emotional freedom tapping is a combination of Chinese acupressure points developed thousands of years ago with modern psychology. So you combine it with a sort of like you tap at the same time as you talk through various memories or emotions, and the idea is that it turns off the part of the brain called the amygdala that's responsible for fear or arousal, or like excess alertness, panic, fear. And there actually are a bunch of studies on emotional freedom tapping. There were a bunch of them done during COVID-19. There's a lot in the VA population, PTSD. It's been done in youth with test anxiety. And one study showed that it did actually decrease the cortisol levels even more than psychotherapy groups. Although I think both are very important. These are just more tools in the toolbox. Another study showed that it was more effective than even diaphragmatic breathing, which I also think is a really, really good tool. So I'm not saying this is better than those. I'm just saying, why not add to the toolbox? And it was actually helpful for patients dealing with overweight and food craving, and helping with cravings. So this is a great book, if you a children's book called Gorilla Thumps Bear Hugs, but you can also go to the a website called the what is it? The EFT, the Tapping Solutions. Let me just make sure it's the right. I have it on my the tappingsolutions.com, and there's also a tapping solution app. They're both free, and they will actually. It's really great because you can pick like anxiety or sleep, and they'll give you like a 2-minute or 4-minute, and they'll lead you through how to do the tapping. So basically, what you do is you choose the issue that you're dealing with, whether it's pain or nausea, or earlier, I knew I had a really, really long day, and I was like, I need a little energy, and I had like a few minutes in between patients. So I just said, my issue was, even though I'm feeling a little bit tired and I have a long day ahead of myself, and then we say, I deeply and completely accept myself. And then what you do is you start with the karate chop point, which is actually a real acupuncture point. It's SI3, it's on the small intestine point. And then you say, but I deeply and completely accept myself. And then you keep saying that, and then you tap through these different points. So the first point is actually that's the last point, the do 20. So you start here on this point here, and then you tap here between your eyebrows, and then you do it to the side of your eye, and then under your eye, under your nose, under your chin, and then under, like by your collarbone, under your arm. And then you do the top of your head, and you go through 3 or 4 times. So I did that. It takes less than a minute or two. And then you take a deep breath out, and then you can reassess to see how you feel. But let's say if you're having a panic attack or something, then you might just say something like, even though my heart is racing and I'm feeling anxious, I deeply and completely accept myself. And then you say it, you say that again while you're tapping here, right here, and you go through the whole thing. So I highly suggest the app, the book, if you want. There are also some, studies looking at EFT and releasing trauma. You may be familiar with this book, The Body Keeps Score, but I recommend it to a lot of my patients. So this is one of the tools, along with things like EMDR, that can be used to help release trauma. Okay, so acupuncture, I've talked about its role. Besides that, there's also cupping, which we also do at our center. Usually if you go to an acupuncture place, you can also get cupping. Traditionally, it's done with fire. Obviously, we're in a hospital, we can't use fire. So we use the suction cups, which work just as well. But that's another option. And patients really, really, really like cupping a lot in our experience. And then over here on the right, this is just to show you how electroacupuncture works. It's very similar to like a TENS unit, which is very commonly used in PMR practices as well. This Energy Points app is a free app, which I highly recommend, which will, again, show you the different points and even time you. You can put in like how long you want to do it. You can tell them, are you interested in stimulation or relaxation? So I highly recommend the Energy Points app. And then, okay, yeah, these are just some of the studies that publications, just to show, and what else? So just to emphasize again that acupuncture is just one of the tools in the toolbox. It doesn't replace nutrition, doesn't replace herb supplement review, doesn't replace medication, a lot of mind-body work, breath work. It's just one of the tools that we will consider using. Yeah, these are some of the resources. And here, so how do you find accredited acupuncturists? So you can check out the American Academy of Medical Acupuncture. Those are basically doctors, MDs or DOs that have done additional training in medical acupuncture. There is a board certification for medical acupuncture, which is like an even higher level. Most states don't require that, but many of the people in the AMA actually have done additional. They've taken a very, very, very rigorous board certification exam. So that would be a good directory to check out. You can also look at the NCCAOM. So these are, this is a registry of board certified acupuncturists. And then So the first one is our MDs and DOs who have done additional training in medical acupuncture. The second one are licensed acupuncturists. The third one is the Academic Consortium for Integrative Medicine. So these are, I think there's about 80 or 90 institutions now, usually medical schools or other institutions that are leading the integrative medicine world, and they will often offer acupuncture services. So if you are near one of those, then that would be a good website to look at. And then you can check your state medical and acupuncture directories as well. Acupuncture is managed by each state, but you know, I think that there are people in the AMA that are from every state, I'm pretty sure, but you can look at the directory as well. I talked about energy points, the tapping solution, so that's what I was telling you about, to check out that website. There are a few YouTube channels like Sloan Kettering, the UCLA Center for East-West Medicine, MD Anderson, Dana-Farber. Some of them have instructional videos and acupressure techniques, but obviously if you just go to the Energy Points app, they will lead you through a lot of those. Yes, Roswell Park had another one that gives some videos. And then Cancer Choices also is a great resource as well. I went a little fast because I wanted to make sure there was time for questions.
Yeah, wonderful. And we had a few questions come in. We also had some of our attendees also share that how helpful acupuncture has been for them.
Oh,
for
great.
you know, helping with peripheral neuropathy that they're experiencing, just sort of, you know, overall side effect management. So, and we talk so much about this, even in regards to pain, what you mentioned. I popped a link in the chat for a pain management education event we've done in the past, utilizing acupuncture to see that science and to hear you reiterate the positive effect of it. We love to hear that, Dr. Loy.
Great.
Wonderful. So a couple questions that came through in the chat regarding acupuncture, some of the benefits that looked at labs. We had one question specifically about neutrophils. Is there any potential benefit that may help with neutrophils specifically?
I don't remember. I don't want to misspeak. So,
Okay.
but it was leukopenia. So neutrophils are a type of, let me see if that paper, are a type of white. So let me just see. Yes.
Okay.
White cell and neutrophil values significantly increased. Yes. That was
There you go. Love that.
2020. Yeah. I just didn't want to misspeak. Yeah.
Wonderful. Love to call that out. Great.
Yeah.
And
sorry. And while I'm thinking about that, I know this is about acupuncture, but my brain thinks about everything. So in another one of the weeks I talk about thinking about food and herbs, there are astragalus and codonopsis, which are food-related herbs in TCM, are very good also for increasing white count and red count. So that's something that I will talk to patients about, and I actually have like a soup recipe you can do. Yeah, kind of just like an herbal broth, and I will include astragalus and codonopsis in it. So that's like another way of
I love that. Yeah, I love that. That whole multi approach to supporting things like white blood cells and labs and all of that. We love that. Okay. So regarding acupressure in particular, you talked about acupuncture for helping with peripheral neuropathy, cancer induced. Any specific points from an acupressure perspective that may improve that side effect, or any advice in terms of what we could do from an acupressure standpoint, if anything at all?
Specifically for neuropathy, is that the question?
Yes.
Yeah. So the way I think about it is acupressure is just massaging on the acupuncture point. So instead of putting a needle in, you're massaging it. Now, it seems that probably the acupuncture is, I don't know if I say it's more effective, but that's traditionally how it's been done, right? So I would say probably acupressure on those same points could be helpful too, but to what extent, hard to say, right?
Okay.
That's what yeah.
Okay. So certainly won't hurt a person if they kind of build that into their mind-body routine.
Not at
Okay.
all. Not at all. Not at all.
Wonderful. And Angela, she's asking for a list of those resources. So this will be recorded in our video library. We can certainly include the additional resources that are in this presentation. Karen is very familiar with the Tapping Solutions app, so we already have some fans there already.
Okay, great. Great.
Wonderful. We had a question about frozen shoulder. So acupuncture, is that helpful for frozen shoulder? And even acupressure, is that something that could be beneficial?
Yes. Frozen shoulder acupuncture is very, very good for frozen shoulder, especially though we have a lot, like, I don't know why it is, but it's like perimenopausal, menopausal, that age group. And then like a lot of our patients get, and acupuncture is probably one of the better ways of dealing with it, in my opinion. I might be biased.
Really?
Yeah. It's very,
Wonderful.
Again, acupuncture is acupressure. It's going to be the same. Like if acupuncture works, acupressure may help a little bit, but you know.
Yeah, because they follow the same points. Okay, but I feel like reinforcing what we may work with a provider at home. It's sort of like when we see a physical therapist, they give you a little bit of homework. You know, when you're home, do these. I feel like it's the same sort of sentiment, so we can really support ourselves with some of those acupressure techniques at home.
Yeah, let me show you. Sorry, I'm going to show under my desk. So I show patients this. It's like $10 at Amazon, whatever, like, or whatever. So this is like a foot roll. So if you just roll your foot on this, you're basically activating all of the points on your foot. Now, is it like very specific? No, but I mean, this is very helpful for people with peripheral neuropathy, just if they're sitting there, right? Something like that.
Yeah, love that. Interesting question from Jane. Love this. Should I ever stop acupuncture?
Should you ever stop acupuncture? I mean, the way I think about it, because I mean, a lot of patients will say, well, once I start, do I have to keep doing it forever? And I will say, no, usually not. I mean, the way I think about it is you do it for a particular reason, maybe, or just general wellness. People do that. And then usually like after a course, it kind of gets better or life changes. And so then you kind of just take a break for a while, but then some patients come back like seasonally for a tune-up. So I think it just depends on the patient, but by no means are you signing up to do it forever just because you start. But if you enjoy it and it's helping you, I think it's a very good supportive tool, you know, and you have access and, you know, that's fine. Yeah. There's no reason.
Yeah. I love that. Okay. Phyllis is saying she had excellent results with acupuncture and lymphedema. Will acupressure help with lymphedema? And maybe this is a good time to differentiate how this may differ from perhaps lymphatic massage, or if there's any correlation between the two.
Yeah, usually with lymphedema, I mean, the sleeve we use a lot. The lymphatic massage, I think, is my go-to OT referral, that kind of thing first. I actually would think about that first, then the acupuncture. Like some things are like better first line to me. That would go there first. So acupressure, yeah, but I would really probably encourage to go the OT lymphatic massage route first.
Okay.
My opinion.
Yeah. Could you show the foot roller again? We've had a request. We may have some buyers. We may have may have people doing some online shopping tonight.
I got this for myself, like, you know, and I just leave it under my desk, but you know.
Yeah.
And this reminds me, there are also acupressure mats that sometimes I'll encourage patients to try, especially if they enjoy acupuncture or they have trouble either with chronic pain or sleep. They are pokey and, you know, not everyone loves it, but that's the same idea where you're just laying on this mat and you're, you know, basically activating more, you know, a number of points.
And I have seen those mats before. I'm always curious as to whether or not they can be beneficial or if there's any, you know, any validation behind them. So, you know, maybe we'll put it on the Christmas list later this year.
Yeah.
Love that. Okay.
I have no affiliation with anything. Okay,
you just know what works.
Yeah, I was thinking neuropathy. I thought, oh, I'll just show them what they have underneath their desk.
Yeah. Dr. Lloyd, we have, is there a website or the name of your practice if patients are interested in following you or getting
Oh,
contact or connecting with
yeah,
you?
you can just Google, it's in Weill Cornell Integrative Health. I guess I can, I'll just Google myself and yeah, it's easy. You can just, or I can give you my secretary's, information later if you want.
Okay.
So that you
Or
can
yeah,
cut the
whatever,
waste.
whatever. Yeah,
Yeah.
perfect. So, and Linda, I'm glad you asked this question because I know we've come a long way in terms of insurance and acupuncture being a covered benefit in some instances. Any comment on that, and even in terms of Medicare, if it's a covered service?
So it's extremely heterogeneous as far as coverage, even within a particular like insurance company and plan. So some of the insurance companies have better coverage than others. I'm not going to name that just from our experience, but Medicare is starting to cover certain indications. For example, low back pain.
Oh,
So many of my patients with cancer have low back pain in addition to other things. So just saying.
okay.
And the more indication, and the reason low back pain is covered because there's so much data on the benefits of acupuncture for that. So once more evidence comes out, then I think a lot of the other insurance companies will follow suit. That's my feeling.
Yeah.
Now, in my state, in New York State, I think it was like, now it's probably 2 years ago, a year or two ago. What's her name? Her name's on my mind right now, but they passed a law, Kathy Hochul, saying that hospitals had to offer non-pharmacologic therapies, acupuncture being one of them. So once these kinds of legislative changes roll out, I think the coverage will follow, but it's a little bit slow.
Yeah, it just takes some
And for my
time.
patients where their insurance doesn't cover it and cost is an issue, there are certain places, and I'm sure in your area there is too, there may be, but in our city, like there's 2 or 3 places where it's like some kind of school for acupuncturists or TCM, and they will offer free or low cost acupuncture that's totally supervised. And so that's sometimes where I'll send patients.
Yeah, I love that. And that's a really good call out for people to access acupuncture as well. This may be a silly question regarding acupressure. Is that usually a therapy that one does at home versus seeing a provider, whereas acupuncture is something you would go to see a provider for? Is that correct? Or, that's
Yeah,
usually
no,
a therapy we could work at home.
that's a good question. That's a good question. I mean, no, yeah, it's something you could do at home. I mean, sometimes when I would do like for my pediatric patients, they didn't really want needles, so then I would do acupressure with them, or I do with a tuning fork. So any TCM practitioner could do acupressure too on the patient, and that's totally fine. You could go see one and have them do acupressure for sure.
Yeah.
Yeah.
Okay.
So
Okay.
that's okay too. Yeah.
Wonderful. Okay, and I know we've got another minute or two. A couple last quick questions for Dr. Loy. Any connections between acupuncture and scoliosis?
I would say to definitely try it. Definitely anything musculoskeletal for the back, I would definitely try it. There's lots of reason to try it. Yeah. Yeah.
Yeah. Okay. Also going back to our evening buying that we'll all be doing, the foot roller, anything similar for the hands, or could that be adapted to the hands? Or I feel like even maybe a little bit of a massage ball, if it's a textured outside, you could sort of
Yeah.
roll your hands around it.
Probably what I would do. And those bumpy balls that kids have, maybe.
Yeah.
Yeah. I don't know. Yeah.
Yeah. Okay.
I'm sure. I don't know. Yeah. That's a good question.
Wonderful.
Yep.
Okay. Any last questions while we wrap up with Dr. Loy? I love all these questions and I love hearing the benefit from personal experiences. So this is really wonderful. Okay. We will be sharing the slides, Dr. Loy, if we could share them with the recording. It'll be up in our UFH library. So please come back, view those resources. If you're part of our local passport program. We've got acupuncture providers that you can tap into as well. But like Dr. Loy said, there's lots of places that you can go to find a trusted provider, whether it's through your oncology center, reaching out on your own. So it's good to know some trusted places to go to.
Yeah.
This was great. Dr. Loy, thank
Okay.
you.
You're very welcome. Happy to.
Oh my gosh. Yeah, thank you for all that you do and sharing your knowledge and
You're welcome.
experience.
You're
We
welcome.
covered a lot this evening.
Yes, no problem. All right. Take care.
You too. Thank you.
Thank
Bye.
you.
Bye-bye.
Oh, amazing. Okay, so we're shopping and we're acupressuring tonight. Is that what I'm hearing?
Absolutely. Yes, I was looking up acupressure mats. So you can get them for pretty affordable, everybody.
Excellent, excellent, excellent. I love this. So yeah, we covered a lot. So grateful to Dr. Loy for bringing, reiterating a lot of what I think many of us know, but hearing that science regarding acupressure or acupuncture, I should say, always good to hear that, and then learning about acupressure and how we can do that at home. So definitely come back, relook at those slides and sort of evaluate some of those pressure points, and maybe building that into our day-to-day routine, I think would be good for all of us.
Absolutely. Absolutely. I think just a great practice, especially for those of us experiencing some of these conditions, right? Neuropathy, trying to navigate from this at-home personal perspective, right? We have our medical team, but we can certainly, like you mentioned with the physical therapy, right? Do that homework when we're at home as well.
Yeah. Yep. I love that. I love that. And I know she kept mentioning, using these therapies as part of your toolbox. So that is prompting me to just gently remind everyone to join me for the remainder of our education segments in May. So tomorrow I will be hopping live on Facebook, Unite for Her's Facebook page, 1 p.m. Eastern Time. What to know about radiation Q&A. I will be joined by Dr. Eva Berlin, radiation oncologist. So answering some of the most common questions, plus those submitted to us, and we've got a ton already. So hopefully I will see you tomorrow on Facebook. And then next week, carrying that same message, we're going to be building our mental health toolbox. So Kevin Hubbard is a tremendous mental health provider. He's part of the Unite for Her network, and he will be helping all of us build our own toolbox. So that is May 28th, 5 p.m. Eastern Time. That is our virtual hangout to wrap up the month of May. All of these will be available, if you can't join me, on our UFH Connect video library. If you go to uniteforher.org/UFH Connect, you can see them. And I did not want to forget, because it's going to be summer soon, and we've got some fun things to look forward to.
We sure do. And of course, I want to highlight from our nutrition team coming forward to summer is that we have another year of Summer Sips coming towards you. So if anybody is familiar, Summer Sips was our series last year where our dietitian team highlighted some zero proof or non-alcoholic mocktail recipes on our blog. So starting on the first day of summer, which is June 20th, we will be releasing a mocktail every single Friday. You can check it out on our social media, and we will have the recipe up on our blog as well. We have them going all throughout the summer, and I can personally say I have seen all of the dietitians' recipes, and they all look delicious. So I'm excited for you all to get to try them and see them very soon.
Yep, I look forward to that every year, so I love it.
Super fun.
And then finally, I'll share my screen again because, of course, we want to give a big thanks to our education sponsors. So tonight's virtual education events are presented by West, Merck, Lilly, Novartis, and Gilead Sciences, with additional support from our gold sponsors, Pfizer, GSK, and Daiichi Sankyo, with additional support from AbbVie, Agendia, and Tercera Therapeutics. So we are so grateful for their ongoing support, and we've got more to come this month of May. But until then, we thank you so much for joining us for our virtual hangout this evening, and hopefully we will see you all again soon.